Welcome, everybody. That's real loud. Welcome. I'm waking everybody up here. Appreciate everybody joining us today. I'm actually super excited. I've been on the stage multiple times in the last couple days, and I'm super excited for this presentation. I won't say this, I can't say you're my favorite, but this might be my favorite, because this is something that's never been done at HIMSS before, where we have an opportunity to speak with care providers that have not historically been seen as part of the care equation and as those that are participating in care. But as we look at an advancing Medicare population, an aging population, and really seeking to keep our population out of the most expensive care setting with acute, we really need to look at expanding our definition of who a provider is that participates in care. And that's exactly what we're going to do today. So I'm Tracy Bell. I sit as the president and founder of No2. I would encourage you to stop by our booth over here. We are the largest communication network in the United States. And I am surrounded here with my fellow colleagues and fantastic partners of No2 that represent different care segments. So I'm going to have them do an introduction. If you guys don't mind introducing who you are, what care segment you represent, and then also the company that you're with. Thank you, guys.
Hi, everyone. Great to be here. My name is Phil Sutherland. I'm Director of Healthcare Solutions with Yardi Systems. And so we're an electronic health record representing assisted living and independent living and memory care settings. We service about 3,000 of those settings across the United States, Canada, and the UK currently. So I've been with the company about 15 years and excited to be here.
Hi, I'm Carrie Myers. I'm the Vice President of Solutions Engineering at Raintree Systems, and we are an electronic health record that specializes in outpatient therapy, so specifically physical therapy, occupational therapy, and speech. We work with very large enterprise groups across the entire country that are seeing a high volume of patients and high volume of Medicare patients. We are in about 10,000 clinics and represent over 60 million visits a year in outpatient therapy.
Hello, good afternoon, everyone. I'm Julia Green. I'm a director with CareQuest Innovation Partners. CareQuest Innovation Partners is the innovation arm of the world's largest oral health nonprofit. We have a mission of making oral health more accessible, equitable, and integrated with the overall health system. As part of delivering on our mission of making oral health more integrated, we see real-time communication between the dental setting and the rest of healthcare as critical, really to all medical dental innovation. So really excited to be partnering with No2 as a catalyst to bring that to life.
Awesome, thank you guys. So I'm going to set the stage here with a patient, Margaret, who just turned 66 this week. And she's managing multiple chronic conditions. She has, I gotta get this right, type 2 diabetes, she's got hypertension, and she also has congestive heart failure with declining mobility, which is not an uncommon patient scenario as we see it today. So that is the nature of our patient. She just recently, unfortunately, did have an admission to a hospital with acute CHF. She went through that acute stay. She subsequently then had a short-skilled nursing stay so she could regain her strength. And then she was discharged back to her home. And her home happened to be in an assisted living facility. So I'm going to have Phil spend a few minutes. I don't know how many in the audience. I'm going to ask a quick question. How many have seen assisted living facility or senior living facilities as a potential area that you could bring in as part of the care equation? A couple of you. So as you're going to learn here today is that assisted living and senior living communities, especially with our aging population, are a tremendous area where we can start impacting care and driving different care to an aging population and prevent the readmission. So with that, Phil, historically, maybe give us a little background, again, on assisted living facilities. What does a typical assisted living facility have for a care team? How are they engaging in a patient's care?
Sure. Yeah. So traditionally, assisted living consists of an RN or LPN that's managing the clinical care delivery, as well as medication technicians that are ensuring the medication adherence and providing the medications, and then direct care staff that is administrating the day-to-day care. So we really specialize in our settings around the activities of daily living and providing the day-to-day care and ensuring that care is delivered effectively. And we've really seen just in the last few years value-based care models, risk-based models coming into our sector, because really 60 to 80% of the overall health and clinical outcomes are based on some of these social determinants of health, like nutrition, functional care, etc. So in our care settings, we really provide a very stabilized environment. And now as EHR capabilities come online, so the majority of these sites are now using connected electronic health records, and we're very much able to interact directly with the formalized healthcare system. So where before you might have a resident admission that was purely done manual via an interview, where, you know, obviously this is an emotional time where, you know, folks are moving into the site, and it's really easy to miss things, particularly when you've got multiple pharmacies involved, you've got multiple physicians and specialists. So the ability to use a network like Know2 and query directly into the healthcare system to aggregate all of that information into the clinical admission process, it's just been a huge game changer for our sector.
Awesome. So tell us about this patient, Margaret. Margaret is discharged from the skilled facility to her home, which is in the assisted living facility, and she's likely had a change in her meds. She likely has some instruction for her declining mobility, so we don't have her as a fall risk. What would the assisted living team do with that?
Yeah, so the way our platform works is what we would do in that case is that would be a transition of care back into our community. We would query out and basically pull in information from really the entire healthcare system. So the hospital stay, PTOT, home health, primary and physician and specialists, and then as part of our workflow for that transition of care, we then compare that to the medical record that we have, the clinical record that we have on file for Margaret, and then our system will allow for import of any updates or changes to the record. So just an incredible change compared to just a few years ago, where all of that was done manually. You'd have the resident and family showing up with paper faxes, and we'd be trying to sort through that, and very easy to miss. So yeah, it's very much a cohesive workflow now.
So now the assisted living staff will look at the changes, right, that we have. So a change in medication, maybe some specific patient instructions that they have to make sure on a timed basis, medication reconciliation, medication adherence, all the things that are all the triggers for a readmit. The assisted living staff surrounds Margaret in her new plan and ensures that she's staying on path with that. One of the things that Phil mentioned also is the use of home health services, PTOT, in her home, again in the assisted living facility, and the need to be able to coordinate with those groups. And so we're going to move on to Carrie. Carrie also, as she mentioned, she represents physical therapy and the team there. So in this transition, well, first of all, let me just ask you a few questions. Tell me about overall bringing PT into overall patient care and patient coordination and the impact that we can have on the patient outcomes, and the cost of care delivery.
Oh, with PT, it's unreal how much we're seeing that PT is being more and more in every aspect of care for patients. PTs see patients more than any other care provider normally on any given week, and that's including in the assisted living and senior living centers. So on an average, for example, a senior living center, a PT could come in and visit Margaret anywhere from 2 to 4 times in a single week and have such an impact on her care. So we are seeing that across the entire nation. With PT specifically, we are seeing a promotion for primary care type benefits with PT across the nation. APTA has done a large movement with this because patients are regularly acting with their PTs, and PTs are able to see and activate a little quicker because they're seeing so many patients and they're seeing them so regularly. Where with their family physician, they may see them, when they get sick or, on a quarterly basis, a couple of times a year when they need their flu shot. PTs are seeing their patients literally 2 to 4 times a week.
That's amazing. So with Margaret, she was prescribed a new pain medication. And tell me the importance of how that would relate to seeing now her physical therapist, because she has a declining mobility. So her PCP ordered physical therapy that persisted outside the skilled nursing facility, but she's on a pain medication. Now you know about it. Tell us how that's important.
So that's one of the biggest things that's so amazing as we talk about going into her home, into the assisted living center, and being able to see that information. A lot of times in the past, like you were talking about, we didn't. The PT is coming into the facility. So they have their own EHR, and they're not always privy to the EHR inside the facility. So they might not know exactly what they're needing. So they're literally going and finding a nurse, finding someone saying, hey, I'm seeing Margaret today, what's changed? And having to have that type of verbal thing now, because the systems are connected, we're able to go in as I go in to see Margaret and say, hey, let me see what's happened with Margaret over the weekend here. And let me see, oh, okay, she had a pain medicine change. That's important because I'm doing mobility with her. I'm doing gait training with her. I'm able to say, hey, I might need to be careful in these areas. She's not feeling it the same way she may have felt it last week or 3 days ago because of the way the medications are impacting her. I can also understand a lot of pain medications can just do simple things from giving dizziness, for example, on standing up. That's something important as a PT would need to do when doing exercises and activities. It could greatly impact her overall outcomes and care. And a PT ultimately not knowing that information could actually physically hurt her and not mean to.
It's really staggering to me. PT has been an important area for No2 as we focused on it some time ago to bring the physical therapy community closer. They're so central to the patient getting better. And in many times we need to see it. We would love to see PT integrated into the primary care model, and it's happening. Some of the MSK models, it's happening. So huge opportunity. And thank you, Carrie. That was fantastic. So we're going to move on to a part of the healthcare equation, the continuum, that has never been considered. And I'm proud to say that No2 and CareQuest have partnered. Actually, last week we finalized it to really start to bring the dental community, again, never been considered part of the healthcare equation, bring the dental community back into the overall care coordination model. Maybe Katie, you could spend just a couple more minutes on that, and then I'm going to get you into questions about Margaret.
Yeah, so the mouth is not separate from the body, despite the fact that we've had different educational systems in place, different reimbursement systems in place. And, there's now a significant body of evidence that shows that your oral health affects your overall health and vice versa. So think about conditions like diabetes and periodontal disease, cardiovascular disease, maternal health. And then there's very sort of tangible use cases, right? You need dental clearance to start chemotherapy. You need medical input before you put a child under anesthesia for dental surgery. So lots of opportunity to be better coordinated in terms of real-time information, and really excited to bring dental into that modern infrastructure of health information exchange.
Yeah, super exciting. It's actually kind of scary to think that you could go to your dentist today and they're going to prescribe medication that could have an adverse effect. And it happens every day. It's a $300 billion problem in our healthcare market today. So with that said, Katie, let's go back to our patient, Margaret. She's on this new pain medication. She unfortunately had some gum bleeding. And so she called her primary care doc and said, I'm having some gum bleeding. I'm diabetic. I have some challenges here. And he immediately triggered and said, I think something more is going on here. So he referred her into her endodontist and said, you need to go see your endodontist. Was able to electronically send a referral, which will happen in the next few months. We'll be able to bring those two ecosystems together, medical to dental. He was able to electronically send a referral. And tell us about what happens after that.
Yeah, so I think medication is a really important use case, not the only one, but a really important one. We talked a little bit with Carrie about pain medication, and Some of you may know this, some of you may not, but dentists are responsible for approximately 10% of opioid prescriptions that are given to adults in the US and are often responsible for first opioid exposure for young adults. So really important that this dentist would understand, what has Margaret been prescribed during her hospital stay, and then really important that this dentist information about his or her prescription is then communicated back to, for example, the assisted living facility, the physical therapist, right? We heard from Carrie about the changes that a physical therapist might make depending on what types of medication that Margaret is on. So pain medication, really important. Antibiotics, another very common med prescribed in the dental setting. So those are just a couple examples among, I think, many that we'll continue to see.
Yeah, amazing. Thank you, Katie. So Carrie, you had a real life example of therapy connectivity in action and what it prevented. Tell us about that.
Yes, so we actually had a patient that the referral was sent out to the wrong care setting. And the patient was basically being sent to an inpatient setting instead of an outpatient setting for physical therapy. Due to connectivity, the referring provider was able to communicate with the physical therapy outpatient group, and the outpatient group was able to pull the correct referral directly from the TEFCA care quality query, and then they were able to contact the patient and the assisted living center and actually correct the issue. So in that instance, it was real time, in real life. Literally, we had a case study that we will be doing on this, but it was able to drastically change what would have probably been a very long, convoluted problem for the patient very immediately just by having that connection.
I'll say that's an unusual interoperability story, right? We usually hear about like medication adherence. I was able to save this patient lives, all super important. But this one, the patient was directed to the wrong spot.
Yeah.
This is not an outcome we typically talk about for those that are in interoperability, that's an outcome of interoperability, but that visibility, that transparency to knowing where the patient's at, being able to see an order that was just created, and she was just literally redirected to the wrong spot. They were able to say, hey, come back, you meant here, come back to us. So awesome story. We're going to just round this out real quickly with, they're all at varying stages in these market segments that they're serving, varying stages of where they're completed with their product, where you guys are at in terms of connectivity. Maybe start with you, Phil. Words of advice that you'd give to any provider in the audience, whether they sit in the assisted living side or in the health system side or others that are managing care.
Yeah, word of advice would be let's talk. This technology and capability, it is there. It exists today. This is really happening generally ad hoc within the industry. So specifically for assisted living, care coordination is happening, but it's done very manually right now. So we've incorporated population health modeling, care coordination capabilities right into the software, and we're able to now digitally connect and coordinate with really any providers in the ecosystem. So at this point now it's a matter of activating the various providers and starting that information exchange utilizing that capability.
Awesome. Thank you, Phil. Carrie, same question to you for therapy.
So for us, the same thing applies. Talk to us. I think we all think that this connectivity is still a thing of the future, and it's not. Like, this is happening right now. We have amazing groups that are connecting and communicating across an amazing network, thanks to people like our partners here on the stage. And I think it's very important for us from a outpatient therapy standpoint. We truly believe that musculoskeletal fall risk patients like Margaret are something that can ultimately change the course and direction of the healthcare of the entire country with better outcomes, and communication is one of the ways that we drive those outcomes and prevent things like fall risk.
Awesome. And Katie, you're the newest to the stage.
I love that. So dental is still very early in this journey, but I would say there's kind of two trends in the market that I think are really going to push this over a tipping point in the near future. I'd say one, I mentioned this before, but the growing recognition and understanding of the importance of medical dental integration on quality, safety, the patient experience. Two, I think dental is a little bit unique in that more than other parts of healthcare, it is a very consumer-driven industry. And I think that's relevant for this scenario in that patients want their oral health to be part of their longitudinal record. They don't view it as separate, even though we've created separate systems. So I think the dentists who want that longitudinal relationship with the patient, those that sort of have this functionality and can treat the patient holistically are going to win in the market. And I think that's going to be a win for patients ultimately too, which is what we ultimately care about.
I just want to say thank you. I'd say personally, I'm humbled to be sitting by this group of people. We, as a company, have very much focused to the markets, again, that we call the overlooked markets. And it's been 14 years personally at this company, starting it from day one and pushing through with teams like these groups, and really the hard work happens at the edge because moving data for data purposes just doesn't matter until you have groups like Yardi, like Raintree, and like CareQuest that are participating and bringing it to life in the care settings that matter. So as a final call to action, I'm going to look for our marketing director. We would encourage everyone to come see the entire community of Margaret's story. It's just literally in this booth right here. Our next showcase is at 2 p.m. If you want to see the whole thing in action, including these EHRs, they will show you their live connectivity. As you see, it's not theater. We're not making it up. It's real. It's available. And we're so glad to connect the Continuum. So I'm going to give everybody a round of applause for our speakers. It's been great. Thank you guys for participating.